Members, it's the appointed time and we have a quorum. Since the last meeting, the Secretariat has not issued any information papers. Items for discussion at the next meeting. Please refer to LC paper number CB bracket 1971/2025 bracket 01 and bracket 02. The next regular meeting will be held on the 14th of July at 10:45 a.m. The administration recommends discussing the following items. A. Preparation for the commencement of the mandatory reporting of child abuse ordinance. And B. Implementation progress of new requirements under the Residential Care Homes Legislation Miscellaneous Amendments Ordinance 2023. Do members have any particular views? If not, we will move on to agenda item 3, review of the Traffic Accident Victims Assistance Scheme. Please refer to LC paper number CB bracket 1971/2025 bracket 03, paper provided by the administration. This item is a financial proposal, so all LegCo members are invited to join the discussion of this item. I'd like to remind members that you should pay attention to Rule 83A of the Rules of Procedures in relation to the disclosure of pecuniary interests. According to Rule 83A, members may not move any motions or amendments or speak on the item if they have any direct or indirect pecuniary interest in the discussion item. So if you have any direct or indirect pecuniary interest in relation to the items that we are going to discuss, please disclose the nature of such interests before you speak. I'll invite the administration to walk us through the paper. Members who'd like to speak, please press the Request to Speak button. Secretary, please. Thank you. The Traffic Accident Victims Assistance Scheme is referred to as TAVA. It was implemented in 1979. It is to provide a modest and timely relief to ease the financial difficulties of victims of traffic accidents on a non-means-tested basis, regardless of the element of fault leading to the occurrence of the accident. Over the past 5 years, we saw an increase in terms of the number of cases approved, and the assistance amount approved increased from $297 million to $492 million. If the income remains the same, and if we continue to see an upward trend on the expenditure, the fund is expected to deplete in 2032 to 33. The government has no intention to abolish the scheme or alter its original policy intent. The purpose of the review is to improve the scheme so that it can provide a modest and timely relief to victims of traffic accidents in a sustainable manner, helping them overcome their short-term financial difficulties. If some families require longer-term financial assistance due to traffic accidents, the Social Welfare Department will provide appropriate support, including referring them to apply for the CSSA or other assistance under the welfare safety net. We hope that the approved scheme will ensure proper use of public resources while preventing abuse and fraudulent behavior. We've already completed the review, and we have put forward 3 recommendations. First, we propose to merge the 2 grants, that is the injury grant as well as the interim maintenance grant, because these 2 grants are similar and their beneficiary groups overlap. Applicants who are eligible can get an average of $383 per month, and they will get a maximum of 60 sick leave days. They'll have to provide a proof showing that the doctor thinks that they need to stay in the hospital for 7 days or they need to get 7 days of sick leave. And this proposal is to prevent any fraudulent behavior. Also, we will restrict repeated applications for compassionate grant. If necessary, the SWD will provide appropriate support for those who have financial difficulties. The SWD has been stringently vetting each application. This includes ensuring that the applicant is a victim of a traffic accident. If necessary, we will verify the relevant information with the healthcare institutions. We'll also refer any suspicious cases to the police. Last year, the police arrested over 300 individuals. These people submitted forged medical certificates to obtain assistance payments in a fraudulent manner. And this was found out because the SWD found the cases suspicious during the vetting procedure. The SWD will continue to verify the information provided by applicants. If possible, we will seek funding approval from the Finance Committee. We welcome any comments from members on the above proposals. 10 members have requested to speak. They are Mr. Benson Look, Mr. Kenneth Leung, Mr. Chow Siu Chung, Mr. Chen Pui Leung, Mr. Frankie Yik, Mr. Andrew Lam, Dr. Teck Chi Yun, Professor Chen Wing Kwong, Dr. Tan Yue Heng, and Mr. Ambrose Lam. I'll give 3 minutes to each member, including questions and answers. Mr. Benson Look, please. Thank you, Chairman. I am concerned about the efforts of the administration to combat fraud. As mentioned in paragraph 14, 300 people were arrested last year involving $14 million. There are a few types of deception cases. Some of them staged a traffic accident, and some of them they forged medical certificates. Some of them they altered a certain image in order to deceive the relevant parties. Some of the scams are organized by criminal syndicates, and people who owe debts, they are forced to take part in these scams. So I think the administration has to step up investigation. People are liable to a 14 years jail term if they are convicted. According to the administration paper, the administration has been stepping up its fraud prevention efforts. How much has the administration been stepping up the efforts? Can you give us some figures, please? Also, in Q1 or the first half of this year, how much sampling check has the administration done? Can you provide us with statistics in relation to the number of breaches of the law? Secretary, last year, in the biggest scam, the criminals staged a traffic accident and submitted forged medical certificates. The police investigated the case. So the traffic accident was staged. It was not a real traffic accident. As for the medical certificates involved, they were forged. They were not issued by a registered doctor. So there wasn't any misconduct of any doctors. I'll ask Ms. Ma to supplement. The SWD vets the applications stringently. When we receive an application, we check with the police to see if it was a real traffic accident involved. Also, medical certificates have to be submitted by applicants. So for any medical certificates issued, we check them stringently. Last year, we got forged medical certificates, and when our staff check the medical certificates, they checked them one by one, and when there were any suspicious cases, they would check with the healthcare institutions involved to see if the medical certificates were real. So please rest assured that we will continue to serve as a gatekeeper, and we will adhere to the principles under the scheme to see if the applicants meet the eligibility. So we are continuing with our work in this regard. As mentioned, we check each medical certificate stringently, so we've been vetting the applications in a stringent manner. Mr. Kenneth Leung. The paper set out the fund's balance as well as the annual expenditure, and the position of the fund is quite worrying. The original intent of setting up this assistance scheme is to help those in need, and I believe it has offered a lot of support and help to those in need. The paper mentions a number of proposals put forward by the administration. For example, the number of sick leave days will increase from 3 days to 7 days, and 2 of the grants under the scheme will be merged. I think the administration put forward the proposals based on certain statistics. However, I don't see any figures concerning, for example, how much money has been paid to victims in the paper. There is a lack of a breakdown. Annex 1 only sets out the maximum amount of assistance payments that could be granted under each grant. If there is a breakdown, we could better understand whether the proposals put forward by the administration are reasonable. Secretary, any statistics? As mentioned in my opening remarks, we have this review because of a major scam that took place. Also, there has been a major increase in terms of the expenditure. The expenditure increased from $297 million to $492 million per year. It is a twofold increase. If we do not review the scheme, the fund will be depleted by 2032 to 2033. I'll ask Ms. Ma to give you more figures. Ms. Ma? Over the past 2 years, well, as mentioned by the Secretary, in year 2023-24, the assistance amount disbursed was about $490 million. In year 2022 to 23, we also disbursed $447 million. In year 2019 to 2020, it was $297 million, but now it's $492 million, so it's a marked increase. I'm not talking about the increase in the total amount disbursed. I'm asking how much has been paid under each grant, and I want the percentage so that we can have a better understanding of why you put forward the proposals.
So I think the member is looking for some detailed breakdown. Ms. Ma, now for 2022 to 23, now there were 5 grants under the scheme under TAVR. We propose to make changes to the injury grant and interim maintenance grant. These 2 grants saw a larger payout. For 2023 to 24, under injury grant, we paid out $340 million. And as for the interim maintenance grant, it's roughly $120 million. Altogether, $487 million. So that makes up 99% out of the $492 million paid to victims. Does that answer your question? I will follow up on this matter later. Mr. Chao Siu-chong. Thank you, Chairman. TAFR has been around for nearly 50 years. That helped many people who had traffic accidents. Professional drivers, in particular, find the scheme helpful. When a traffic accident happens, those people don't have to worry about income because those people live paycheck to paycheck. I'm looking at the income and expenses and I'm looking at the balance. It's only right for us to make some changes, and a review is in order indeed. We should keep the fund robust. We have to guard against abuse. But that should be one side of the equation. We also have to bear in mind the need that the fund is supposed to serve. Now, the proposal now is to merge the interim grant and the interim maintenance grant. We will have a compassionate grant instead, and the payout will be $330 per day. Wouldn't that be too harsh? You are reducing the payout by 2/3. The ERB offers allowances at $300 per day. So that grant can only support that individual per day. But what if this individual has a family? How can we support the family of a traffic accident victim? Say this victim has a minor at home below the age of 15, and this victim loses their income because of the traffic accident. Can we keep the grant at $530 per day? Now, for the review that will happen every 2 years, the support will last for 60 days. That's a buffer for this victim to apply for other social welfare assistance schemes. Now, what if this person is unfortunate enough to have multiple traffic accidents in 2 years' time? Now, will the social welfare department be flexible in dealing with such a victim in expediting the assistance schemes this person applies for? Now, on the refund of assistance payments in 2022 to 23, it was 32.5%. Now, we have the protection of wages upon insolvency fund. The government tries to recover the money from the employers. But here, under this fund, TAFR, the situation is different. But what measures does the government have in place to encourage victims to recover money from the parties at fault so that they can pay the money back to the government? Undersecretary. Now, for professional drivers, in an employment relationship, those people are not under this scheme because those employees get 4/5 of their pay under their employment insurance. Now, for self-employed drivers, those people will be covered by the scenarios Mr. Chow just mentioned. On flexibility on the part of the SWD, now we are tightening the scheme, but there are other funds. With the social workers' referral, there will be timely and moderate support for those victims, and Ms. Anissa Ma can tell us in a moment. So we have more than one policy working here. Now, when you have a civil claim and damages are recovered, the money can be paid back to the government, but on the details, Ms. Anissa Ma can tell us more. I thank the member for the questions. Under the new arrangement, the daily grant will be $330 under the compassionate grant. No means test applies under TAFR, and this is a no-fault scheme under TAFR. The point about the scheme is to offer timely and moderate support to tide those victims over the short-term difficulties. TAFR has been around for more than 40 years, since 1979. Other assistance schemes are now available, other resources are now on stream. They can help the people in need. Now we propose a review every 2 years. A victim may struggle to get assistance when they have more than one traffic accident, but then there are other assistance schemes under the SWD. Now we have the Teng Xiu Kin scheme, we also have the Li Po Chun scheme, and also other schemes, other assistance schemes. Those schemes can offer quick assistance to victims. Now, when a traffic accident victim has a family to support, the social worker looks at the circumstances of the victim. When there are urgent needs, we process the application quickly. Now, on the refund. Refund happens when the victim gets assistance or compensation under other schemes, say the victim has insurance coverage. There is a statutory requirement that when the victim gets assistance from other schemes for the same traffic accident, and this victim has received grants under the TAFR, this victim will have to pay the assistance under TAFR back to the government. If the victim has no other assistance from other schemes, no refund is needed. Next, Mr. Champuila. Now, having a compassionate grant in place of the injury grant and the interim maintenance grant. So under the current scheme, you as a victim can get up to $160,000. Now under the merger, the maximum grant will be roughly just below $198,000. I wonder how we arrived at the new grant level at $330 per day and 60 days maximum. So why do we consider this an appropriate level? Why this amount? On the suspected fraud cases we came across, over the past 5 years, 698 cases were referred by the SWD to the police. And that's 1.5% of all cases. Only 6 people have been prosecuted so far. So I want to follow up on the question from Mr. Benson Look that went unanswered. The SWD reviews cases. You get 9,000 cases every year. How many cases were reviewed proactively by the SWD? What's the share of those cases among all cases? The assistant director said the SWD took a rigorous approach, but then more than 90% of the cases were approved. And for approved cases, will the SWD set an indicator on a certain share of cases that you will review? Now, on the refund of the assistance payment, the refunds represent the source of revenue for the fund. Over the past 5 years, how much did we get back through refund? Now, someone may be on interim maintenance and injury grants at the same time. Those victims also get their insurance payout under insurance policies. Insurers paid the victims, but those insurers were not aware that those victims actually got money from the government's TAFR because of poor communication in the past. Now, communication has improved. So I wonder if the government can speed up the communication with insurance. So let the insurers know right away the moment you released TAFA payments so that the victims can pay the assistance money back to the government. Acting Secretary. We look at the number of vehicles in Hong Kong every year. We get a sense of the size of the problem by the levies paid by drivers. We want to keep the fund sustainable. We have to keep the fund on a self-financing basis by setting the daily assistance at this amount. And when a victim considers the amount insufficient, there are 4 other funds under the Social Welfare Department for the victim, and those are non-means tested schemes. So for someone who is already financially struggling, we can offer support. But for TAFA, it's non-means tested and it's a no-fault scheme. It doesn't matter whether the victim is at fault. We want to keep that unchanged. Back in 1979, there weren't so many transport options. There were no skateboards. There was no electric vehicles. So the traffic accident risks are higher now than before. So after an assessment, we have arrived at this proposal. I wonder if we can have some time for the SWD to talk about engagement with the insurance sector. Yes, please continue. On engagement with the insurance sector, we are aware of the issue and we have strengthened communication with insurers. So once we process an application and we're ready to release the assistance payment, at that point, we also write to insurers, letting the insurers know that the victim will be paid under TAFA, and we let the insurers know right away. Does any other member wish to speak? Please press the request to speak button. Otherwise, I will draw the line here after. So we will allow members to speak up to Ms. Judy Chen, and please be mindful of the time limit. Mr. Frankie Yik. TAFA is well intended, but it has seen serious abuse. Some people mockingly call this scheme a reward scheme. More than 90% of the applicants have their applications approved. Those people can get up to $160,000 for 6 months, roughly $20,000 per month, better than going to work. Some people staged traffic accidents. People who claim to be passengers and drivers applied for the scheme, but then the police caught them. Abuse is serious. So I support this proposed change to TAFA. I do have a question. Why do we still allow people to file an application within 6 months after the accident? If someone has an accident, they should file the application right away. The longer the window you allow people to apply for the scheme, the more room you allow intermediaries to step in and tell people how to get money out of the government. Usually such accidents are minor accidents involving some minor injury. Say you crash into someone's bumper and you had an injury to your lower back. The people went to places like the pain centers, they went to chiropractors and they got 3 weeks sick leave. And then they applied for the scheme for 6 months payment. So I wonder if we can have a centralized medical board to assess the severity of injuries for these traffic accident victims. The same goes for industrial accidents. There are many cases of bogus industrial injuries. You can complain about pain by going to a doctor, and there's no way to verify the injury. So I wonder, for doubtful cases, whether we can refer these victims to a centralized medical board for an reasonable assessment.
Acting Secretary, I've heard the members' views. I'll ask Ms. Ma to supplement afterwards. Right now, we only receive or accept medical certificates from Western or Chinese medical practitioners. We do not accept certificates from chiropractors. Say a person does not suffer from any pain, but the person submits a certificate, then we will check with the healthcare institution. Ms. Ma, on the point about 6 months, there might be cases where victims do not file applications right away after a traffic accident. The victim may need time to receive treatment, so we want to allow time for people to apply. Mr. Andrew Lam. The injury grant and the interim maintenance grant are different in nature. However, I'm not against the merging of the two grants. We've had about 9,000 cases per year, and according to your paper, in year 2023 to 24, 30% of the cases received involve the interim maintenance grant. Now, among the 2,000 some cases that involve the interim maintenance grant, do you have any information about the background of the doctors involved? Now, about the newly proposed compassionate grant, over the past 2 years, some 2,000 people applied for both the interim maintenance grant and the injury grant. Over the past 1 to 2 years, how many applicants applied for the grants over twice over the past 2 years? Ms. Ma? I thank the member for the questions. On the number of applications for the interim maintenance grant and the injury grant, the member is right. There are 30% of cases that involve both of these grants. For the interim maintenance grant, it is for those income earners who've lost their ability to work due to traffic accidents, and thus they suffer from an income loss. A lot of these applicants are self-employed persons. For those who are employed by companies, they normally get sick leaves or paid sick leaves, and they aren't eligible for this grant. According to the paper, we provided statistics from year 2021 to 2024. We have provided figures for those that applied repeatedly over the past 2 years. There are 19% of them. Over the past 3 years, well, those who made repeated applications, it was about an increase of a few percent. Dr. Tek Chi-yun, just now the acting secretary said that it is hoped that this scheme will help those in need. Now, you're proposing to shrink the scheme in terms of the amount of grant that you will offer. We have seen a higher number of cases over the past few years, and that's a higher expenditure. And the fund is going to deplete soon if we do not review the scheme. I hope the government will think about the problems behind. We've seen an increase of 60% in terms of the number of cases. This may be because of a higher number of traffic accidents. Can you talk to the relevant department so that we can educate the public and we can have better road facilities, then we can tackle the problems at root? Now, on the problem of fraud, so we have seen forged medical certificates as well as bogus medical conditions. Can you make phone calls to verify the authenticity of each medical certificate when you vet the applications? You can ask your staff to make phone calls. That's easy, and that can help you verify the authenticity of medical certificates to prevent frauds. Now, some victims, they first go to the chiropractor and then they go to the orthopedics and then they go to see a psychiatrist. How can you ensure that victims in need can get the assistance instead of having people abusing the scheme? So my first question concerns forged medical certificates, and secondly, how do you manage the medical conditions of victims involved? Acting Secretary. Well, we look at the incentives. Are there incentives for people to scam money out of the government? In the past, it costs a lot for you to stage a traffic accident. You at least need a car, for example. Nowadays, it's a lot easier. Say you have an electric scooter and you run into a pole, then you can call the police and then you can apply for the grants. Well, this is a no-fault scheme and we disperse the grant immediately. This is non-means tested, so there are huge incentives for people to scam the government out of the money. There were cases where victims got over $600,000 of grant. Our staff look at each medical certificate submitted. For major healthcare institutions involved, we may not necessarily call them up to check the medical certificate because they are well-known healthcare institutions. So as mentioned, we look at whether there are incentives. We want to reduce the incentives. And if people have financial difficulties, there are other funds that can offer help to them. Well, my questions were not answered. Well, you are reducing the grant and you are reducing the incentives. I don't understand this logic of how you can prevent frauds by doing so. And also, how can you better manage people's medical conditions? Well, if there are no incentives, I don't think there will be complicated medical conditions involved. Say the victim may be a self-employed person and he can make an assessment on whether they need so many sick leave days. He may go to the chiropractor first and then the psychiatrist. But this is just a short-term grant for the victim. This is not to tide the victim over long-term financial difficulties. That's why I mentioned about incentives. This is what I meant. Professor Chen Wing-Kwong. I think the compassionate grant should be dispersed where necessary. The grant will be reduced from $918 to $330, representing a drop of 65%, and the highest number of grants will be dropped from $165,000 to $19,800, which represents a drop of 88%. This is a significant drop. For those victims in need, I think this amount of grant is not enough. Now, I am concerned about the problem of forged medical certificates. It is a criminal act. How do you prevent people from making repeated applications? A victim may first go to a Western medical practitioner, then a Chinese medical practitioner, then he may go to a physiotherapist. Some people may even scam money out of an insurance company. Well, do you have a mechanism to assess the victim's medical situation? Take work injuries, for example. Victims, they can go to the labor department to have their work injuries assessed. I have been working in this area for about 10 years. You need a mechanism to assess whether a victim actually suffers from the medical condition claimed. You need to build a platform like Dr. Teck Chi-yun said. I want to see if the administration can supplement. Is there such a mechanism in place, Acting Secretary, for those in genuine needs? Apart from TAFA, there are at least 4 funds under the social welfare departments that can offer timely support to those in need. We can disburse funds to those in need right away. For those who have financial difficulties, well, our staff from the SWD will look into their situations. This is different from those who suffer from work injuries because in work injury cases, employers will have to get involved and they'll have to make compensation for those who have lost their ability to work in the long run. Now, this fund, TAFA, it offers modest and timely support to those in need. We do not have in place an assessment mechanism because employers are not involved to pay compensation. We'll study whether there is a need to have this mechanism in place. The original intent is to help people tide over the financial difficulties. Professor Chen, well, doctors may be the gatekeeper, but if you have a patient come in and you tell the doctor you suffer from pain, then it's hard for the doctor to make a judgment. If you can have a group of doctors working on the platform, it would be much more helpful. This would reduce the stress of doctors. Well, I think this is not just about assessing the medical condition. You can have a centralized platform to act as a gatekeeper to disincentivize people to deceive the government. Dr. Tan Yueheng. Thank you. I think this is a good review. There are different welfare schemes and projects, and a lot of them have not been reviewed for years. This scheme is a case in point that shows us that there can be room to further improve these assistance schemes. We need to adopt a more targeted approach to support those in need, so I agree that there should be a review and there should be changes to the scheme. Now we see an increasing number of applications and the amount of money disbursed has been on the rise as well. Now technology has been developing by leaps and bounds, and we can make use of technology to improve road and traffic safety. We should not have a higher number of traffic accidents. This is not healthy. So we should lower the number of traffic accidents as well as the number of applications under this scheme together. So we should look at the data. Also, I am concerned whether this scheme is being abused. I am concerned whether there are any fraud cases. Last year, the police investigated some 5,000 traffic accidents, some 500 traffic accidents. About half of them involved forged documents. Are there any ways for us to tackle this? Just now there was mentioned that registered doctors could provide medical certificates. There are many registered doctors. For example, can you have only registered doctors working for public hospitals to issue medical certificates to victims? Also, for each case, can you verify the medical certificates provided with the medical institutions involved?
Acting Secretary. I thank Dr. Tan for his support. Now, on getting victims to visit a public healthcare institute, actually, roughly 80% of TAFA victims did visit public hospitals. Those people did go to public healthcare institutions. And because of that, we do not propose a change to the current approach on that regard. Indeed, as Dr. Tan pointed out, we should be driving down the number of traffic accidents. We want to reduce the incentives so that people don't just stage traffic accidents. Our roads should be safer over time, and that's what we want to achieve. Mr. Ambrose Lam. Now, people trying to apply for the scheme have to meet the requirements under Cap 229. But that ordinance only covers vehicle-related accidents. TAFA was set up to provide timely and moderate assistance to traffic accident victims. Now we're trying to promote a low-altitude economy. Drones for delivery are a form of transport options. Now, drones deliver takeaway food to Ma On Shan. And then in the Science Park in Lanma, we will also see drone flight routes. You may even see drones in urban areas. So when a drone falls off and someone gets hit, that person will get hurt. This is no speculation. That has happened more than 10 years ago. Someone sustained lung injuries. Sure, there's third-party liability insurance for drones, just like cars. But people have to wait for a couple of years before they get the insurance payout. The same applies to traffic accidents. So will the government consider taking this opportunity to amend the legislation so that we cover drones under TAFA? Acting Secretary, I thank Mr. Lam for his suggestion. Indeed, transport options evolve over time. Now, we are not trying to amend the legislation at this point. We can talk to the Transport and Logistics Bureau. If they see a need to amend the legislation, then they can deal with the change in one go along with other changes. Mr. Stanley Lee. TAFA is well-intentioned. In our district level work, we come across people in need. They can apply for these schemes to support their families. The paper points to abuse of the scheme, so that the government proposes merging two grants and we're lowering the assistance payment. But we want to crack down on people trying to abuse the system. Aren't we creating collateral damage by massively reducing the payment for people with real needs? I agree that we should clamp down on abusers, but I'm worried that we're also affecting people with real needs. Is this change because we're really out of money for the fund, or are we trying to tackle abuse of the scheme? Let's get our goal clear. If tackling abusers is what we want, then we should be thinking about ways to strengthen inspections. Or are there ways to stiffen the penalties for abusers? We stiffened the penalties of feeding wild pigeons, for example. So, can the government tell us what exactly are we trying to achieve under the proposed changes? Acting Secretary. I thank Mr. Lee for his questions. The point of the TAFA scheme is to offer moderate and timely support, and we're sticking to this original intention. We're scaling back the payment. But let's bear in mind it's a non-means-tested scheme that offers swift assistance. For people in need, we do bear in mind whether they will be affected. That's why medical social workers are out there, and the SWD also has 4 other funding schemes to assist victims. So you can think of the TAFA scheme as the foundation, along with 4 other schemes, labeled Chen, Tang Xiu Kim, Polo Yin, and Quan Fong. So those are 4 extra schemes offering assistance. So for people who have had a traffic accident, the impact will be minimal. The biggest impact will be on those who are trying to abuse the system. My concern is if there remain many cases of abuse after this change, then we should be thinking about stiffening penalties. Mr. Michael Teen. This paper discusses enhancements. The maximum payment will go down by roughly 90%. So you really have 2 tools in your toolkit. One, reducing the incentives for abuse. So potential abusers can only expect a much smaller payment. That's why they will have less reason to abuse the scheme. And then you also propose strengthening verification. Because when you propose strengthening verification, you are suggesting that the abuse cases you have uncovered may be just the tip of the iceberg. But what's at center stage today seems to be something different. 698 cases, but the police arrested less than half of the people involved, and only 6 people were prosecuted. So the prosecution rate is shockingly low. So verification isn't really the focus here. Why not focus on quality instead? Cases were referred to the police, but the evidence appeared to be way too weak because the police arrested fewer than half of the people involved and only prosecuted 6 people in the end. That's the worst part. So can the government tell us what will be done about this? Acting Secretary. Mr. Tin has a point. We want to reduce the incentive, and second, we want to strengthen verification. That's because most people submitted real documents. It's a non-means-tested scheme. People go to a doctor and obtain a doctor's note. No forgery is involved in such a case, and there's nothing the police can do. Now, on the number of abusers, we have so many cases of abuse because there is a strong incentive under the current scheme. The cost for staging an accident has gone way down. people can access the grants easily now. That's why we want to reduce the incentive. So you're saying there's nothing you can do? So you're saying there's nothing more you can do in the quality of the cases you refer? Nothing you can do when the doctor lies, when they issue the doctor's note. Do something about the doctors, acting secretary. Doctors are subject to oversight by their professional boards. We do not question the credibility of doctors. So you're saying there's nothing you can do. Then why bother stepping up verification? You can check 70,000 cases and then the police prosecute the same number of people. They arrest the same number of people and then they just prosecute 6 people. Mr. Tin, I think the point from the acting secretary is it's hard to establish the doctor engaged in misconduct. I'm trying to monitor the government's work. If I can think of every idea out there, then I would be in charge. I see the focus, I see the problem as lying elsewhere. I'm focusing on the quality of the work done. The government's approach is to reduce the incentive. There's little for abusers to gain. That's the government's point. But the problem seems that for a doctor, say I feel dizziness, I'm hospitalized, the doctor issues a doctor's note. And when someone complains of pain, it's hard to verify the problems behind. So now the government's approach is to reduce the incentive. We want to show abusers that they have little to gain. That's what we're trying to do. So that's better than nothing. But for us, we think there is something that can be done. The government should do something about this. The policy goal of the scheme is to offer timely support. No means test. We have struck a balance after weighing all these factors, and then we have come to this proposal. Ms. Connie Lam. Now I have some questions about the TAFER scheme. Now people will need 7 days of sick leave instead of 3. This is to guard against trivial claims. But the government has not provided the figures. From 2021 to 24, there were 19% of cases involving repeated claims. How many such cases were minor injuries involving abuse? Have we analyzed the share of minor injuries? Were 3 days as the threshold? Now, for repeated applications, they may be from professional drivers, like taxi drivers or goods vehicles drivers. Those occupations come with a risk. Will we consider exempting those occupations under the new scheme? A higher threshold may end up penalizing those high-risk occupations. Now, on the compassionate grant, people can only apply for the compassionate grant once every 2 years. But then for those struggling financially, the SWD provides support such as referring people to the CSSA. But then you have a delivery worker getting into 2 no-fault traffic accidents. Say they are hit by someone driving while drunk. So that delivery driver will be barred from assistance. The SWD may refer the delivery worker to other schemes, but then the CSSA comes with a means test. Wouldn't that go against the policy intent of this scheme, which is no means test and no fault? The first question can be taken by Ms. Anissa Ma, but I want to address the other point from Ms. Connie Lam first. The government should be reducing traffic accidents. The TAFER scheme now is a no-fault scheme. The victim may be at fault or not. In any case, the victim can access payment under the TAFA scheme. Every driver should operate their vehicles with caution. And when there's a huge incentive in the form of a larger TAFA scheme payment, then drivers may be less careful. That's why we're trying to reduce the incentive, and we're also trying to reduce traffic accidents. Now, for higher risk occupations such as self-employed drivers, they should be driving with care. Now, Ms. Anissa Ma can take the other question.
Thank you, Chairman. Now we look at the gravity of people's injuries. Over the past year, among the applications we received, most of them involve minor injuries. Over 90% of them involve minor injuries. Thank you. Next, Ms. Judy Chen. Thank you, Chairman. The proposal helps the administration allocate resources more effectively, so I support the proposal. I have the following questions. You said that 80% of the victims, they go to the public hospitals. Can you ask victims to go to designated doctors or institutions? For those that involve minor injuries, they can go to, say, a certain group of doctors. That way, victims will not criticize the judgment of the designated doctors. That's my first suggestion. Secondly, on the point about incentives, I'm worried that if the threshold is higher for those that have genuine needs and those who are not abusing the scheme, they may suffer with the higher threshold. We want to focus on combating frauds, say with X-ray examination or MRI. You may still not be able to find out the cause of the injuries or medical conditions. You can only, for example, allow a doctor to issue a medical certificate after the patient goes to, for example, the district health centers. There are district health centers in all 18 districts. You can ask the victim to attend a certain number of hours of rehabilitation courses. You can enhance the threshold this way instead of having the victims receive the assistance payment only. You should ask them to attend, for example, certain courses. Acting Secretary. We have about 93% of victims who went to public hospitals. Only a few percent of victims went to private medical institutions or clinics. We want victims to go to a doctor that they trust. If they think that they suffer from certain pain, they should go to a doctor that they trust. Well, from the government's perspective, you should also have doctors that you trust. So 90% of victims went to public hospitals or clinics. And we were able to confirm the medical conditions claimed by these victims. We will see whether we should work with the district health centers as suggested by the member. I drew a line already, but some members have asked to speak for a second round, and Mr. Chen Kin-po for the first round. Yes, it's your turn, Mr. Chen. You're speaking for the first round. I was in another meeting just now. Sorry about that. I thank the administration for rolling out this proposal. I support the proposal. Some victims, or some people, they scam money out of the government as well as the insurance company. We have so-called the award schemes. I have had a number of meetings with you, and you know the severity of the problem. Over the years, we haven't had any review on the scheme, and public money was wasted. I am not a member of this panel, but I am here because I do want the administration to roll out the proposal as early as possible. So this is just a suggestion or a comment. I'm just here to express my support. Thank you. Mr. Bill Tang, 2 minutes. I'll be quick. After a traffic accident is reported to the police, you'll get a number. If a traffic accident involves illegal acts, for example, illegal car racing or illegal carriage of passengers involving white licensed vehicles. It could also involve electric bikes that are illegal. Well, if there are unlawful elements involved, would you accept the application for assistance payments as well? Well, this is a no-fault scheme if it involves other legislations. For example, if the car is not supposed to be used on the road, or if certain traffic legislations are violated, the police will prosecute the people involved. However, if the person sustained real injuries and if the person has genuine needs, he will still get the support under this scheme. Well, are we adopting an approach that's too humanized? If you're talking about a passerby who is innocent, of course, the person will be eligible. But if it involves a driver driving a white licensed car, would the driver still be eligible? Well, this is a no-fault scheme. For some cases, the unlawful elements involved might be obvious, but for other cases, it takes time for the investigation to be conducted. So if it involves illegal elements, it will be up to the police to carry out investigation and prosecution. I'll have members speak for the second round. 2 minutes for each member. Mr. Kenneth Leung. I just want to reiterate my views. I was asking for some figures. How many percentage of cases where people apply for, say, 3 to 5 sick leave days, or how many people apply for, say, $20,000 or $30,000 of grant? Can you provide the statistics after the meeting? Yes. Next, Mr. Michael Teen. We might be able to offer help. Last December, the police arrested some 40 people involving in staging a traffic accident. Some people were not prosecuted. And according to the paper, you're processing certain cases. And can you tell us the details of these cases and what is the maximum penalty involved in cases prosecuted? Ms. Ma. Last year, the police carried out investigations and made arrests. As at the 2nd of June this year, the police have already prosecuted 19 people. Some of them have been convicted. Some were sentenced 2 to 3 months of imprisonment. You said 6 people were prosecuted. Well, these people were included in the figures. What is the highest penalty involved? 2 to 3 months of jail term. Well, if convicted, what is the maximum penalty? For those convicted of fraud, it's 14 years of jail term. But currently, the highest penalty was 2 to 3 months of jail term for those convicted. Dr. Tek Chi-yun, I'd like written reply from the administration. Now you're proposing to reduce the amount of grant and this is to disincentivize people from committing frauds. Well, I don't understand the logic, but the main point here is to combat fraud. So my first question is, how can you better manage medical certificates? There were forged medical certificates submitted. You said you would have staff check each medical certificate. Also, how can you better manage people's medical condition under the scheme? This is to better combat frauds and prevent frauds. I hope that you can provide a written reply on this. We'll have a written submission after the meeting. Well, in the interest of time, we have to move on to the next item. The administration plans to submit the financial proposal to the Finance Committee in July this year. Do members support this? All right, let's move on to the next item. Special scheme to import care workers for residential care homes. Please refer to LC paper number CB bracket 1971/2025 bracket 04 and bracket 05. I'll invite the government representatives to join us. I'll also invite Acting Secretary to walk us through this paper. Members who would like to speak, please press the request to speak button now. Secretary, over to you, please. Thank you. We are here to brief members on the implementation of the special scheme to import care workers for residential care homes. This scheme was rolled out in June 2023. We aim to safeguard the employment priority of local workers, and at the same time, we want to import workers to alleviate manpower crunch. The quota was nearly exhausted in the first half of 2024, so in July last year, we increased the number of quota, and so there will be 15,000 quota for RCH to apply for by batches in the following 3 years. We have already approved 8,300 quotas for the RCH sector, including the quotas for contract renewal. Since 2024, we've increased the number of quota, and since then we have approved 1,600 new quotas. In the latest round of application, all applications were approved. The increased quota help alleviate manpower crunch in the RCH sector, and it helps ease the workload of local care workers, and this also helps ensure service quality. As at March 2025, about 17,000 care workers, and 6,700 of them are imported workers. Under the special scheme, there is a clear mechanism to safeguard the rights of care workers. For example, RCHs must not displace their existing local care workers with imported care workers. Also, subvented RCHs and contract RCHs may apply to import a maximum of 1 care worker for every 2 full-time local employees. That's a 1:2 ratio. For private RCHs and self-financing RCHs, they may apply to import a maximum of 1 care worker for every full-time local employee. The ratio is 1:1. The government seeks to safeguard the rights and benefits of import workers as well. They are entitled to the same protection under the Hong Kong's labor laws. If there are any violations, the government will impose administrative sanctions. We seek to also nurture talents. In the 11 district social welfare offices of the SWD, from August 2024 to March 2025, they have organized over 50 events, and over 10,000 attendances were recorded for such activities. The Labor Department also, towards the end of 2024, held 2 major job fairs. There were on-site interviews as well. We welcome any views from members. Thank you.
9 members are waiting to speak. Here's the lineup: Mr. Bill Tang, Mr. Stanley Mr. Michael Tin, Dr. Frankie Ngan, Ms. Connie Lam, Dr. Tanya Heng, Mr. Chao Xiu-chung, Dr. Tek Ji-yun, followed by Mr. Tommy Chang. 3 minutes per member, questions and answers inclusive. We start with Mr. Bill Tang. This is the special scheme to import care workers for residential care homes. Along with other labor import schemes, the FTU calls for restraint in implementing such schemes. This is a matter not just for the Labor Department, but also for the Social Welfare Department. Jobs should go to local workers first. We also need to continuously monitor these expanded labor import schemes. We have to look out for any downward pressure these schemes put on the wage growth for local workers. Now, we also have to guard against unscrupulous employers. They may be just a tiny fraction, but they may be exploiting the imported workers. They bring in imported workers as cheap labor to replace local workers. The FTU makes these principles clear every time we discuss such matters. Now, for the scheme about care workers for care homes, the FTU has handled cases where imported workers are exploited. Every month, the money is transferred to bank accounts, but their bank cards are confiscated by the employers. The imported workers were paid in cash only. There have been such court cases. How can the government ensure such cases do not happen again? Now, there are some less than scrupulous employers going for alternatives. The contract says the worker works 10 hours per day, but then the workers are made to work longer hours instead. What can the government do to prevent such contractual breaches, which are also a form of exploitation of the imported workers? Now, we have the ratio of 2 to 1. One imported workers for every 2 local workers. But then that ratio may be valid at the point of importing workers. Later on, the local workers are asked to leave so that you have more imported workers and fewer local workers. What can we do to ensure the 1-to-1 ratio or 2-to-1 ratio, 1-to-2 ratio remain valid? And what will be done when such ratio does not hold? Acting Secretary, jobs go to local workers first. Now let's look at the median wage for care workers. The annual wage growth is roughly 2% per year. In 2021, when we were still in the COVID years, there was no wage growth. But except for that year, there has been wage growth every year for local care workers, and we will keep an eye on the overall changes. On inspections, the Social Welfare Department can take that question. For irregularities, the Labor Department, the Immigration Department, and the Social Welfare Department look at those cases from their respective perspectives. Now, we also look at the performance of a care home under the contract. Now, on the ratio of local versus imported workers, we do keep an eye on that. Care homes have to go through the scheme to apply for renewal of their contract or when they want more spots under the quota system. So that ratio is dynamic. The overall principle is jobs for local workers first. Most operators want to find suitable workers, local workers, as the first option. Mr. Stanley Ng. Thank you, Chairman. I wonder what's the government's position on the special scheme. So will we rely on imported workers as a long-term measure to maintain the services at local care homes? We say jobs for local workers first. That's the principle. But we have given up on that principle under this scheme. I fail to see how we're attracting more local workers to care homes and work as care workers. The government has given up on the principle of jobs for local workers first. I fail to see how the government is adhering to that principle. Now, as Mr. Boateng just said, it's about the ratio of local workers versus imported workers. For public care homes, it's 2 local workers for every 1 imported workers. And for private care homes, it's 1 to 1. How can we enhance the ratio? The government stresses jobs for local workers first. These ratio apply to care homes, not for the job function. Now, for some care homes, they have a lean staff, so the government says it's not appropriate to look at the job function specifically. But care homes have to hire at least a certain number of care workers. So we have what it takes to enforce a ratio, the minimum ratio. So why not do that to show the government truly adheres to the principle of jobs for local workers first? We agree that jobs should go to local workers first, but we have to be mindful of our aging population. Every year, 50,000 people retire. But there are only 30 to 40,000 new entrants to the job market. Our workforce is shrinking. Of course, we have fresh sources of population, such as those coming here under the Top Talent Pass scheme. For care workers, you don't even need a primary education to enter the industry. I think the requirement is just primary 6. And we are seeing a shrinking population of people with just a primary education, because now people enter the job force at least with a secondary 3 education. Some people turn into health workers or nurses. Care workers are a junior position. We want people to fill these positions. And when we cannot find such local workers, we have to look elsewhere. There is retraining for care workers, but few people sign up for such courses. Last year, only 400 people completed the scheme and became care workers under first hire then train scheme, but 400 was far from enough from meeting the local demand. But this is a fact we have to face up to. Mr. Michael Tin. Manpower in the elderly care sector has been top of mind for me. In mid-May, I took part in an award scheme for excellent workers in the elderly care sector. I think the undersecretary was there as well. Now we have drone technology. And the SWD also announced plans to turn enrolled nurses into health and care practitioners at QF level 4. Now young people are more willing to join as health and care practitioners. So now you also have imported care workers. So we bring in the junior workers through imported workers. So now I have much greater confidence in the long-term development of the elderly care sector. I want to thank the government for the work. But then, last Friday, for 8 skilled trades, the caps were relaxed for the imported workers. The most pertinent trade or job function was nurses. but the procedure has to go through three sectors: the Department of Health, the Nursing Council, and also the Immigration Department. Applicants hesitate the moment they realize they need approval from three government departments, and they wonder if the government can streamline the application procedure. Acting Secretary, we thank Mr. Tin for telling us about the situation in the sector. Now, when we do have to bring in imported workers as a last resort, we want local workers to take up more senior positions so that we bring in the workers to fill the more junior positions. Elsewhere, imported workers are brought in for the mid-level or senior positions, and that's bad for social stability, and that's what we are trying to avoid. Now, on bringing in skilled workers, that effort is part of the overall task to bring in skilled workers. Overall cap 10,000 workers. So for each sector, they are subject to a cap of 3,000 workers. So for each of the 8 sectors, the trade is subject to a cap of 1,250 workers. We're working with the Nursing Council. Once the council accredits the courses, then there will be a special registration path for those imported nurses, and those nurses will be able to work at public hospitals. We also train local nurses. So we have local nurses and imported nurses, and they go hand in hand. So you have to streamline the procedures. We know the members come, and we will talk to the Nursing Council about that. Dr. Frankie Ngan. A few follow-up questions. First, inspections. So for care homes that have imported care workers, how many inspections have been done? Do those care homes follow the ratio, and do they follow the rule of letting go of imported workers first? And how many do we have the enforcement figures? Now, about the ratio, 1:2, 1:1, regardless of post. So the point is to hire local workers for more senior posts and import care workers for junior posts. So would that mean that future care workers will all be non-local workers? What would that mean for the prospects of people joining locally as care workers? Can we tweak the ratio? Can we put some limits on the ratio? 1:2 ratio or 1:1 ratio? Can we do some post-specific ratio? Now, I want to discuss the first hire then train scheme. Only 400 people underwent training to become care workers. What new steps can we take to encourage more new entrants? We're now caught in a vicious cycle. We want new blood for the industry, but we allow care homes to import care workers on a ratio regardless of posts. If that's the case, why would people bother signing up as care workers? Why won't people simply go for the nursing stream instead? I wonder what new enhancements we have in place for training. Now, how many care workers are we short of? We have done a few rounds of labor import schemes. How many care workers do we still need to import? How many care workers will be able to train locally? How many care workers we will have to import? We have to end the labor import schemes at some point. Labor import schemes are an expedient. When will we end the labor import schemes? Acting Secretary. Dr. Ngan's question is when we can end the labor import schemes. I, for myself, would like to see the end of the scheme quickly. But this is beyond the control of either the chairman or me. More than a quarter of our local population are aged over 65. We encourage seniors to work, but not every job works for seniors. Seniors can work as health workers, but not as care workers, a job that is more physically demanding. We will try to recruit local workers for care workers as much as we can. We would like local workers to join at the mid-level. And for young people, they're better educated now. They can fill more demanding posts for higher pay. We try to get local workers to join different posts as much as we can, and if we cannot find enough workers, we bring in imported workers.
Chairman, a lot of my questions were not addressed. The question about inspections, any enhancement measures, and so on. Acting Secretary. This is the same as the enhanced supplementary labor scheme. If there are changes to the enhanced scheme in the future, we will also revise this special scheme. We adhere to the 1:2 ratio under the special scheme. And this applies to different sectors. This is because people cannot take up different posts at the same time. For, say, electric engineers, it's hard to adopt a different ratio. Can the administration provide a written reply afterwards? Yes, please provide a written reply. Ms. Connie Lam. Thank you, Chairman. The special scheme to import care workers for RCHs adheres to the principle of jobs for local workers first. I support the scheme. And according to the paper, there are measures to safeguard local care workers. There are specific mechanisms to protect local care workers. For example, in case of redundancy, imported care workers should be laid off first. Also, RCH must prove that they have put up recruitment ads for 14 calendar days before they apply to import workers. Now, since the implementation of the special scheme, have there been any breaches of laws? Do you keep any statistics for monitoring purposes? For example, over the past 2 years, how many cases involve breaches of the relevant legislation, and what was the penalty? And has the mechanism been effective in protecting local care workers? Now, on the requirement of RCH having to put up recruitment ads for 14 calendar days, what if RCH lower the threshold and hence disincentivize local workers to apply for the jobs in order to import care workers? Have there been such cases? Have there been bogus recruitment advertisements in the past? Acting Secretary. In year 2024, we received 34 complaints. As at April this year, we received 43 complaints. We, in year 2024, issued 2 written warnings, and this year we received 2 warnings. And last year there was 1 prosecution and 1 conviction. If anyone breaches the requirements, we would issue warnings to them. There are also administrative sanctions. For those who do not comply with the requirements, there will be administrative sanctions. Sorry, Ms. Lam, what was your second question? I asked about recruitment advertisements. Were there any bogus advertisements? Are there any penalties in place? Ms. Yao. RCH must put up recruitment ads for a continuous period of 14 days, and we did sampling check. We have to ensure jobs for local workers first, so all along we have been asking for a confirmation letter from RCH. And there was in compliance, and it took time for us to investigate the relevant cases, but so far no RCHs have violated or breached the ratio set under the special scheme. Next, Dr. Tan Yueheng. Thank you. We have seen an aging population over the next few years. 1/3 of our population will be people aged above 65, and the average lifespan will be 87 years. There will be an increasing demand for care workers in Hong Kong. Care workers care for our people, and we need human workers. Regardless of how rapidly AI develops, it cannot replace human care workers. I agree that we should have local care workers as the majority, and therefore I support the measures rolled out by the government to attract new blood to join the sector. I also think that care workers should be listed under the policy portfolio for developing silver economy in order to attract local workers. It is mentioned in the paper that a new professional rank of health and care practitioner will be established. This is to ensure a career progression path for health workers. There will be different training schemes to facilitate the development of the sector. However, even with the training scheme and even with the new professional rank established, how many new blood will the government be able to attract to join the sector? Will the government look at how much we are short of staff in the sector? Will there be professional institutions or vocational schools, as well as post-secondary institutions offering relevant courses to nurture higher level care workers? According to the paper, there has been 50 events organized by the SWD. There was a job fair and 10,000 attendances were recorded for such activities. And RCHs have been offering more than 1,100 job vacancies. So how many people did the RCH recruit in total? Acting Secretary, I thank Dr. Tan Yueheng for the support. We want local workers to take up higher level posts. With the shortage of manpower, we need imported workers. Let's see if the SWD has any figures. If not, we will provide the relevant information afterwards. We have health workers, care workers, as well as nurses. Only local workers can take up the health and care practitioner post. We also want more frontline staff taken up by local workers. However, the salary is not high, so we have fewer local care workers taking up the post. We want local workers taking up mid-level to higher level posts. However, for junior posts, we do need imported workers to help share out the workload. Next, Mr. Chao Xiu-chung. 2 years ago, this special scheme to import care workers for RCH was rolled out. According to the paper provided by the administration back then, the administration said it had made an assessment and some 700 posts had to be added, and because of new projects being implemented, 2,200 workers were needed, and in total 4,500 workers were needed. And the government set a quota for 3,000 imported workers, and 5,000 vacancies were for local workers. Back then, we had 50,000 some care workers. 4,000 of them were imported workers, and about 10,300 were local workers. Now, in 2025, we have 17,000 some care workers, and 6,000 some of them are imported workers. For local care workers, 2 years later, we see a drop. The vacancies did not manage to attract local workers to join the sector. 2 years ago, we had about 11,000 local workers. Now we have only 11,000 2 years later. Can the government keep monitoring the situation? We have about 11,000 local care workers in Hong Kong. Can you review the situation regularly? Can you check whether imported care workers have reduced the number of local care workers? For median monthly wage for care workers is about $15,000. For subvented RCH, we know that the salary is about $17,000 to $20,000 per month. I think $23,585 are allocated to subvented RCH, and you are spending $15,000 per month to hire one imported care worker. Well, does that give incentives for NGOs to hire local workers? The special scheme has been rolled out for 2 years, and we see a lower number of local care workers since the implementation of the scheme. At the same time, there has been an increase in the number of imported workers. Is it possible for the government to increase the threshold? Can you ask RCHs to use the median monthly wage to hire imported workers to safeguard employment priority of local care workers? Also, we want a better progression pathway for local care workers. It is mentioned that a new professional rank of health and care practitioner will be established. Now, I understand that 3,000 nurses could be imported under the talent scheme. Institutions may recruit imported nurses under the special registration pathway, and that hinders care workers from developing their career. Acting Secretary, I think 2 years ago we amended the relevant legislation. We need a large number of nurses because RCH with 60 residents or above, there must be a nurse, and there is a huge gap for us to fill. So we need a huge supply of nurses locally. Also, the number 3,000 is wrong. We have 10,000 quotas. Each skilled trade is about 1,250. And the cap is 3,000 in terms of the quota. So it's not that we are importing 3,000 nurses. It really depends on employers. The health and care practitioner rank is dedicated to elderly care service sector. So for those who are interested, they may join the sector with the new professional rank to be established. We have a lump sum grant for local RCHs, and the grant is to hire local workers, but that's up to the RCH. Anyway, this grant is to ensure enough manpower. It's hard for us to ask RCH to use the money to hire local workers, and they are using $19,900 per month to hire a local care worker. So I don't see how RCH are trying to save money.
Then why are we allowing care homes to hire imported workers at $15,000? You hire locals at $19,000. You have to hire at the local median wage. So the first question is whether the care homes can hire people. There are 11,000 local care workers, but many are retiring. New care workers are hired locally. Local care workers retire at some point. And because of the aging population, you're seeing shrinking local care workers. To ensure quality of service, care homes need workers, and that's why there will be some turnover. Over time, the shortage of care workers will be 10%, and we hope that we can plug the gap through the labor import scheme. Acting Secretary, there was a question about the other figures. The median wage is a level of wage where the employers have to pay those imported workers. And for these imported workers, the employers will have to pay for the accommodation of the imported workers. For local workers, the employers don't have to pay for accommodation. Employers can charge no more than 10% of the accommodation costs from the imported workers. So it's cheaper to hire locally than to get imported workers. Dr. Tik Chi-yun. We have to be realistic. Elderly care homes have been struggling to hire workers. Importing workers go some way to plugging the gap. There are also manpower and administrative issues. But now I see lopsided development. In the future, we will have to rely on imported workers to plug the manpower gap. We don't have enough local workers. The paper mentions ways to attract local workers to become care workers, but I doubt that will work. I doubt you can bring many workers into the industry. It's not about the pay. It's about the poor work environment. Some weeks ago, I visited Japanese care homes. Many young people worked at Japanese elderly care homes. Those young people enjoyed their work. Because in Japan, there's a clear career path. They can start from a junior level. Eventually, they become the home manager. When young people see a career path, they take an interest in the job. And they also do highly professional jobs. Now, for our care homes, you only have older workers and you lack a professional image. Continuous career development also matters. In Japan, a job at a care home also gives people a sense of mission. It's meaningful work people are doing. But do we offer the same work environment in Hong Kong? No. You won't be able to hire people even at $20,000. There's no sense of fulfillment. The work does not look professional and the work is obnoxious. Leaving these problems unresolved will mean we will have to rely on imported workers over the long term, and that's unhealthy. We're offering some sort of career path, but we can do better. How can we do better in terms of professional training? Can we give young people a sense of mission? And then you can get more young people to join the trade. Otherwise, any discussion is pointless. You simply bring in more imported workers. Acting Secretary, I want to clarify a point. Japan also relies on massive amounts of imported workers. Their imported workers work elsewhere, outside care homes. In Hong Kong, the situation is different. Every aging society relies on importing workers from elsewhere. That's a fact. Dr. Take knows the licensed care homes well. Care homes with rather limited means. But at this event last week, where Mr. Michael Ting was also there, the privately run care homes have more resources and they offer better conditions. With the legislative change to the care home laws, some care homes of the poor quality will have to go. We hope that we can improve our care homes so that more local workers can join the industry, and we're seeing hope. And we will keep an eye on the industry. Chairman, I don't want to bicker with the acting secretary on this point. If the government is so confident, can we get a key performance indicator from the government? Say, can we set a number of young people who will join the elderly care industry in 3 years' time? Why not have a KPI to reassure people from trade unions? Can the government undertake to set a KPI? We do have a ratio, it's 2-1. We stick to the 2-1 ratio for care workers. That's our KPI. We're almost out of time, so I will extend the meeting for 15 minutes. Mr. Tommy Chung. Thank you, Chairman. I know people from trade unions complained about importing labor. There was a time when care homes did not import workers. People get to choose their job. Our economy has been robust. There were some brief periods when unemployment shot up, such as during the SARS times and also during the financial crisis. Our unemployment rate was somewhere around at 2%, now it's at 3%. Other places would have done everything to have our level of unemployment. We're almost at full employment. Wages have been going up, and that's partly because of this requirement to hire imported workers at the local median wage. Trade unionists have nothing to worry about. Employers hiring imported workers have to pay the workers at the local median wage, and they have to pay for accommodation. They can only charge up to 10% from imported workers. If a local employer can hire a local worker, they will not resort to imported workers. So I think all that criticism of the Labor Department about importing workers is unjustified. I rarely give my support to the Labor and Welfare Bureau, but I have to say this. Can we find a way to get rid of the requirement about paying imported workers based on the local median wage? I don't need a response. This is a suggestion. Ms. Lillian Kwok. Thank you, Chairman. I support the importation of workers for the short term. We need manpower to plug the gap so that we can keep our city running. But in the long term, we need to train local workers. So we have this navigation scheme for young people. The dropout rate has been on the high side. I know there are various reasons. The work is demanding. Some people realize the job is not for them after a while. But I wonder if that would mean we're wasting resources. We're not really training people who take an interest in the profession. Or maybe people take the navigation scheme as a springboard. We have to review the navigation scheme for young persons in care services. Are we recruiting, admitting the right people to the navigation scheme, given the high dropout rate? Or should we be recalibrating the navigation scheme? Do we still need the scheme? If we keep the scheme, how do we enhance the scheme to make sure we better use the resources? And can we include the training of the navigation scheme in secondary school education? Some secondary school teachers attend such training in the evenings. They take the exams, they get the qualifications with QF qualifications. That's because those teachers want to be able to offer care training in care services at secondary schools. So why not make training in care services part of secondary school education? In that case, you can have ready-made, ready-trained workers straight out of secondary schools. Now, there are people who just retired at the age of 60. They can work. Now, the Haven of Hope Hospital just raised the retirement age for the workers. In some areas, can we raise the retirement age? That's something we can consider. Acting Secretary, I want to give a consolidated response, not just to Ms. Kwok, but also to Mr. Tommy Cheung. Care workers are similar to other jobs, like cleaners, servers. These are physically demanding jobs with low requirements, so people can switch between these jobs. And those jobs I just mentioned, cleaners, servers, are also short of workers. The focus today is on care workers. Ms. Kwok mentioned more training for care workers. I would rather have our local students receive training for health workers instead of care workers. That's because care workers need just primary education. When someone completes their secondary school, they will have secondary 6 education. It would be a waste for those students who go into the care worker stream. So we leave it up to young people to decide which job they take. We do want to encourage more young people to join the care industry. I mentioned secondary schools because some schools and some teachers are already doing this. Not every student can pass all the 5 core subjects at the HKDSC, but they manage to earn their qualification with the qualifications framework accreditation. So we should be helping those schools and teachers to give students the skills. Those students can earn the certificates even at secondary 5. So maybe this is something the LWB can talk to the Health Bureau about. So point noted. Any other business? No other business. I adjourn the meeting here. Thank you.